So educational, personal, promotional. So that's the second one. Let's look at the third one. The principals are going to hate this one. So I treat every team member for free. So remember, Breaking Bad, get them hooked. So every member is treated for free. But there's certain conditions associated with that free treatment. So let's have a look at those conditions. Because the girls or men in your team will want the treatment, do it for free. I get so many dentists, nurses, hygienists that come and see me, but they go, oh, our boss is charging us full price. We might as well go and see you to do it properly. I do it for free. So there's certain conditions we do to say to our, nurses to get free treatment. First, we can use their before and after pictures. So we take good quality before and after. We have permission to use them on our website, social media, also in-house. So when you've got a patient interested, we can show that patient the before and after. Number 2, they have to give us a 5-star Google review. So as we know, the more Google reviews you have, the higher your website will rank. So they are actually a patient. We've treated them for facial aesthetics. So they will give us a 5-star Google review. Number 3, they will be a model patient. So what we mean with that is if a patient comes in and sees us, wants Botox treatment, we go, okay, Karen's had it, get Karen in, she can show them. Because a lot of people, especially with Botox treatment, you're going to have a frozen look. Karen showed them I can sort of and raise my eyebrows. It will convince a lot more patients. Don't do what one American dentist does. He makes t-shirts and he has the before and after pics on the t-shirts and they have to wear at work all day long there. So I don't think you get away with that in England and Wales. But finally, the best one is, because we got them hooked, they're going to want the next treatment in 3 to 4 months' time. And I say your next treatment in 3 to 4 months' time will be free as long as you refer 5 of your friends. I guarantee you they always find 5 friends there. And those 5 friends pay our normal price. So you've got 5 new patients straight away. Who likes that one? So you lose a little bit of money at the beginning because you're paying for the cost of material, but I'll guarantee you with the before and after pictures, the 5-star Google review, the model patient, and the 5 friends, you're making money easily back and much more. Okay. I'm going to give you a bonus framework because you've been so good and you come early. So bonus framework number 4 is organize an open evening. So first, don't just do it on facial aesthetics because there's sort of stigma, embarrassment with certain patients. Because if you just do it on facial aesthetics, you won't get many patients coming in case they're worried about bumping into their friends or family. So do it with one of your dental services. So it could be facial aesthetics and Invisalign, facial aesthetics and teeth whitening, facial aesthetics and implant. So in case they do bump into someone, no one knows what they're actually there for. So we're going to do an open evening, obviously for our existing dental patients, but we also invite friends and family of our dental patients that are not members of our dental practice. Because the mistake I made early on is I tried to convert most of my facial aesthetic patients to dental patients. We were a private practice. Most of them were happy with their NHS dentist. They didn't want to swap. So you will get patients coming to you just for facial aesthetics, not for dentistry, which is not a problem. So open evening, combine it with one of your dental services. 2, invite your dental patients, but also in the invitation, say to your dental patients, your friends and family are more than welcome to attend that are not members of the dental practice. And we divide that opening evening into 3 parts. So the first part is a mini talk. No more than 10 minutes maximum. And the mini talk is like this in front of your audience in the open evening. But what I talk about is all the objections they could come up with for Botox and fillers. Because while you're talking, the mind wants to protect ourselves. And they'll be thinking of all the objections of why not to have the treatment. So what you should do is Google 10 myths about Botox, 10 myths about lip fillers, and that's your talk. Overcome all those myths and objections. Because you want to overcome their objections before they thought about it. So maximum 10 minutes, myths about Botox. Don't call it myths about Botox. Obviously, intertwine your normal talk with the 10 myths of Botox, 10 myths of dermal fillers. So that's number one, mini talk. Number two, we're going to do a live demo. Excuse the pun, this is where you could kill two birds with one stone. Remember your 3 team member you're going to treat? Use one of them. Do it on a team member because they know that team member, they see them on a regular basis. Make sure your team member's not needlephobic or hemophilic. Don't want them to bleed to death or screaming while they're having the treatment. And we normally just do Botox. Botox is finer needles. The only downside is they don't see the results straight away. So do a mini live demo, mini talk, objections, myths. Number two, live demo. This is quite important. We've had so many patients say, I didn't realize how quick the procedure was or how comfortable the procedure was. And it's cost them over the line to book in. And then number three, we will have a question and answer session, but we do it in private. Because when I first started, I used to ask questions and no one would ask any questions in front of their friends or family. So I would go back to the surgery, my team members would be hanging around, and I'll say, if you've got any questions, please see my team members and they'll come and see you for a private consultation or private chat. And we do an opening every 3 months. And you'll be surprised how many patients you'll convert because they see it in the flesh, they see you talking, etc. So the 4 frameworks. Number 1 was talk to every patient. Mr. Jones, I know you're not going to be interested. Just to let you know, we started offering facial aesthetics. Here's 5 of our cards. Number 2, e-newsletter every 3 months. Number 3, treat your team member for free. You'll get your money back times 5 with 5 friends. And number 4, organize an open evening. So I just want to talk about advertising. So just a warning, don't shoot the messenger. I'm just relaying the information regarding regulation. So dermal fillers are not POMs. They're not prescription-only medicine. So you can say what you like, do what you like. Botox, well, Botox is a trademark name. I'm going to come on to that in a minute. Is a POM, prescription-only medicine. There are tight regulations. Basically, you cannot advertise Botox. So internally, you can say what you like. So internally, where patients are coming to see you can have posters, you can have before and after pictures, you can have banner stands. If you are doing any internal advertising, a couple of things. 1, if you do say the word Botox in any internal posters, you have to have the symbol R next to it because it's a registered trademark. Also, in theory, you can only say Botox if you actually do use Botox. Most people don't use Botox. They use the other brands, Azalor or Bocacure. Obviously, if you do use Botox, that's fine. But Botox is a trademark name like Hoover Vacuum. Patients call it Botox, but most patients don't have Botox. So you need to make your patients aware that you're not using Botox. So on our consent form, it has all the brands of toxin and we circle which one we're using and we verbally tell the patient which one we're using. So internally, you can do that. Externally, you cannot say Botox, you cannot have before and after pictures, you can't have price lists, you can't say we do Botox injections. So externally, that means your website, social media, you've got a shop front window, any external posters, newspaper ads, postcard drops. So I know what you're thinking, everyone else is doing it. MHRA, which are responsible for the advertising of medicines, they are not proactive, they're reactive. So one way to get rid of your competition is to ask them up to the MHRA and they'll send them a warning letter. So you cannot do anything external, before and after pictures, price lists, websites, etc. This is what you can say, which is allowed. So you're going to want to write this down. This is what you can say. So we offer anti-wrinkle injections. So we offer anti-wrinkle injections only after a face-to-face consultation with a medical practitioner. So we offer anti-wrinkle injections only after a face-to-face consultation with a medical practitioner. So as dentists, dental professionals, we are medical professionals. They want you to emphasize a consultation, because you can't phone your GP and go, how much is it a box of whatever medicine you want? They have to have a consultation first. And Botox is like, no, it's the same as any other medicine. Emphasize a consultation. So what we do when a patient rings or responds to social media, we say, you can book in for a free consultation, because we get a 98% conversion. If a patient's not willing to come in for a free consultation, I don't want that type of patient. So emphasize the consultation. As I said, don't shoot the messenger. I'm just conveying the information.